Hey everybody, welcome back. Over the course of time, over the last year or so, and the last 30 plus videos we've made, you guys have seen me do a few different videos where we used waterproof liner. um, in those videos, we've done arm cast and leg casting, all of which using the waterproof type base that allows the patients, the kids, the adults, whatever, to get their cast wet, go swimming, go underwater, take normal showers without bagging it. And we've talked about a bunch of stuff. Well, in some of the comments of some of those videos, those previous videos, I've had some people ask, and I've had some private messages as well. People have asked for some little tricks of the trade, if you will, little things like they saw me do something real quick in a video, and maybe if I could go back and revisit that or slow it down. So, if you will, we're going to call this a waterproof cast tricks of the trade type video, if you will. I don't exactly know how I'm going to title it in the bar, so it's easy to find when you're searching it. But I'll figure that out after we're done editing. But anyway, we're going to use a waterproof liner. And we won't be doing much casting. This is all the stuff that goes prior to laying on the fiberglass. But again, it'll be some really, really cool tricks you can use when you're applying waterproof casting. Again, I have one particular brand that I favor. I'm not really, I don't know if I'm at liberty to advertise for them or not, as I'm not, obviously I'm not getting paid to do that. But besides that, I don't want people to think this is the only option, because there are other options out there, but this is just the one that I favor. So if in the course of it you happen to see the logo or the brand name, I just know that I'm not trying to do that on purpose, or I'm not trying to steer you a certain way. So that being said, I'm going to grab some of this material, we're going to get set up, and we're going to go right into tricks of the trade with waterproof casting. So first things first, in some of the videos you see me start the waterproof cast liner at the wrist, and I start working my way, and then we work our way up through the hand, through the fingers, and to be very, very honest, those of us that have been casting or ortho-teching for a long, long time, this is the way it was always taught to us, to start at the wrist, create an anchor, and then you work your way up and then back down, which is fine. And I'm not saying that it's wrong, but I'm going to show you something new. I want to show you something it's pretty cool. I want to show you something because this material is a little bit more forgiving than the cotton is. You can actually lay this down, and it's okay if it wrinkles, but I want to show you something. You want to put a little split right here, just a little split. Put it in between the thumb. And what you've done automatically, you can see you're stopping the padding right above the palmar crease, which we all know, golden rule, you want the padding to go just above the palmar crease because the fiberglass is going to stop below the palmar crease. So if you start at the hand, you lay it down, and we already know this, the soft side always faces the skin, and the tacky side always faces the top, or the tacky surface is meant to stick to itself. The non-tacky surface is meant to be against the skin. And again, we'll just do a little split here, not a big deal. We'll go around the thumb, and I want to show you something. This is super cool. You now have taken care of the 2 layers of padding that is required at the hand. So you're done. And now a lot of us know when we're working with cotton padding, we're supposed to kind of mold and shear and cut and keep rolling with it. That's not the case with this stuff. This stuff, you stop right there. You just stop right there. You just stop it. There's nothing saying that you have to continue on with it. Nothing at all. And then what you do, now let's go back to that whole premise of the wrist. You come back to the wrist, start straight, start flush, and now you're working your way down the arm. So first trick is the hand trip. That right there is slightly different than what we've all been trained since way back when, since back in the day. You don't necessarily have to start at the wrist. And here's the important part. I'm going to stop here for a second. Watch this. Look at the nice contour you have here now. Because you didn't start at the wrist, you have nice contouring, so when you go to lay your fiberglass, it's going to lay down there and you can shape it and mold it really nicely without a bunch of buildup there. And you have the hand protected. We're going to talk about all this in a minute because I have more tricks to show you. We're going to go ahead and work our way down the arm, finish this up. We all know we overlap halfway every time. You don't need much more than that because, of course, we're going to use the safety tape. We'll talk about all that in just a few minutes. You want it 2 to 3 fingers from the anicubical bend. So we're pretty much almost there. Now I'm going to show you the next trick. Get ready for it. Watch this. You take a strip. That's going to go all the way around. So about here. You take that strip, and I want to show you something. We all know how if you look at the padding, there's one channel. There's one channel that's wider than all the rest. You fold right where that channel is. Fold it over itself. Now remember, the smooth side goes up against the skin, right? That leaves the tacky side to stick to itself. And what you've just done is you've created something really, really nice for the patient. You have now created a bumper. You and I and everybody who's making casts knows we are going to stop the cast at this line right here. And we're going to allow 2 rows of padding, which have been folded over. So technically it's actually 2 rows on top of 2 rows. So you got 4 rows of padding there to create a nice bumper edge. The cast will stop right here, and we'll do the same thing up top. So that's the fold, and then I'll show you another trick up here at the hand. Watch this, watch this. We'll do the same thing we just did a second ago. We'll do the same exact thing. We'll fold just like we did a second ago to go around the hand. Now watch this. This is really cool. Let's say right here where the seam is. Let's cut that right there. And check this out. That cut you just made, put it right there, right under the thumb. Fold it under, come around. You just did the exact same thing here that you did down there. Nice padded surface. You're going to stop the cast right here, right at this line. You're going to stop the cast. You know what? Here, I'll do this. You're going to stop the cast right here, and you're going to stop the cast right here. And that's going to allow 2 rows of folded over padding to protect the edges of the skin. Now the last trick I want to show you on this short arm, is the bow tie. Well, there's 2, and they both apply to the thumb. There is the bow tie method, which I'll show you now. In his case, his thumb's a little smaller, so we're going to just cut 2. You can cut 2 or 3 depending on how big of a thumb you're dealing with. Cut 2 up, fold in. Cut 2 up, fold in. And then what you do, take the corners and catty corner fold. Catty corner fold, all 4 of them. I want to show you what we're doing here. We are creating what is known as the bow tie. There you go. And what you do with it, you take it, sticky side facing down, bring it at the base of the thumb, wrap it around like you would wrap around a ribbon. And what you've just done for this young patient is you now have, follow me, you have padding here, you have padding here, because the cast is going to stop way down here. So you have padding all the way around the thumb, 360 movement, and you have padding down here at the base of the cast. So you've just, this right here is exactly what you want your padding to look like, your waterproof padding. And then, stay right there for a sec. You take your safety tape, and where those lines are is where you put your safety tape. You stop there, and you stop there, and you cut your safety tape on both sides. Turn over, please. Same thing, you stop right there, and you stop right there. And again, not to waste the safety tape, but you put the safety tape on, and then of course you lay the fiberglass on top. Some people, just to be fancy, some people would like to fold this over. That is entirely up to you and your clinic's policy, so that if you're working with kids, they're not messing with it. Other people, I'll show you, other people like to lay the safety tape underneath and then lay this on top. That is totally fine. And it's a very, very nice professional appearance. That is your decision to make. There's nothing saying one way is better than the other. It's your choice. So that's the first set of tricks I want to show you as far as tricks that would be for the short arm waterproof cast padding. We're going to move on to a few other tricks and then we're going to wrap it up. So we're going to transition that little those short arm tricks we just did. We're going to convert that into a long arm, and there's a trick I want to show you with the long arm as far as the elbow goes, and the exact same trick can be used when you're doing a short leg waterproof cast. The exact same trick, but it's kind of important. You'll have providers, doctors, surgeons, PAs, whoever you're answering to as an ortho tech. That you will hear them. You will hear them talk to patients and try to steer them away from a long arm waterproof cast or from a short leg waterproof cast. And you'll hear the provider say, well, the water's going to collect at the elbow or the water's going to collect at the heel. Nothing against the providers. Providers will always, that's their job. They are the provider. And whatever the provider tells me to do, I'm going to do or not do, as long as there's not a risk to patient safety. However, if you are properly trained with waterproof material, you can make a long arm waterproof cast or a short leg waterproof cast where the water does not collect. And if I may take that from you, I want to show you the one thing that makes the difference. And that is that right there. That is what makes the difference as far as whether you will have a successful long arm waterproof cast or a successful short leg. And it's what we're going to do is we're going to create a channel using those pre-cut strips. We're going to use a channel, we're going to make a channel that goes around the elbow or around what would go around the heel, where the water can just pass right from the top of the cast, from the proximal end to the distal end. And I'm going to demo that for you as we're doing it. So we're taking the strips, and we're going to apply these in just a moment. I want you to see that I've removed that bumper that I had right here, that bumper that we had there. I took it off because we're going to continue. We're going to everything we did with the short arm, it applies to the long arm. Everything applies the same. So what you do is you do everything you did, you're just going to continue on. And now what you do when you get to this point and you're wrapping the waterproof material, when you get to this point, you take your pre-cut strips. And remember, the smooth side goes against the skin. You take your pre-cut strips, lay them on the end part of what would have been your short arm, and then again up here at the top of the arm. And what you're going to do is you're going to take your row of waterproof material, and what I want you to do is I want you to just create a strap right here, just nice comfortable strap to hold that in place, just like so. I want you to cut a V right here. Let me get my scissors. Stay right there. Stay with me. Stay with me. I want you to cut a V right here, about halfway up. So it spreads right there. Turn your arm this way so they can see. You keep coming around. Come back up. And then as you come towards the bend, cut another V, but at the top. And what it's going to do, the two V's facing each other are going to act like a lock. And it works really, really well. And then all you do is you lock down that channel that you made without putting too much padding at the crease. You're keeping the padding very minimal at the crease here so you still have your nice right angle. And you stop it right here. Now what you've done, and again I'm going to take the camera from the patient here in a second. I want to show you something here. What you've done is you've created what is almost a long arm. We have to go a little higher, just a little bit higher. But what you've done is you've created a long arm. You still have a nice bendable crease here. You can get your nice right angle, and you have a ton of padding back here. But more importantly, and I'm going to go over here. You can go ahead and put your arm down, take a break for a second. I know your arm's getting tired. Yeah, there you go. There's a couple little small spots here that are a little thin. We just take a little piece here, and we just kind of patchwork it. You're always going to have scraps. Never get rid of your scraps. You just put it right on there. Put it sticky side to sticky side. Lay it on there and just patch up the thin spots. Nobody's going to count against you for doing that. And you can work your way up again. We're not finished because we're going to go up to about here when we're all done. And then again, same thing. Once we get to the top up here, we're going to put that bumper like we did before on the short arm. But the most important thing I want to show you is this. I'm going to spin around to the other side of the room, and I want to show you something that's really important here. So as I mentioned a moment ago, you can use those same channels when you're doing a short leg waterproof cast. And if you look in here very closely, you can actually see this is an actual cast. There was an actual cast worn by an actual patient. You can actually see where the channel was made right here, right about the calf level, and how it came all the way down. And what that channel does, now I'm going to demonstrate for you. What that channel does, I'm going to scoot this stuff over. Hold that for me right there. I want to show when the water goes in, the cast, you're taking a shower, you're in the pool, when the water goes in the cast, you can see where the water's resting in the heel. Now this is the thing that the providers are always warning the patients about. The water's going to collect in the heel. You won't be able to get it out. You won't be able to, it'll be trapped there. It'll create an ulcer. It'll create a maceration. It'll do all these things. Again, I'm not saying to go against what the provider tells you to do. I'm just saying show your providers what a little bit of training will do. What a little bit of training will do, you can impress not only your patient and give really, really great patient care, but you can show your providers how you can take the patient care to the next level by using the waterproof cast. And I'll show you, get ready, tap, 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 as if they were tapping their foot as they got out of the shower. And again, we're going to focus on the inside here. You can zoom in as close as you want, and you are not going to see anything other than a few little droplets. And just to prove it, I will put my hand and I will show you exactly how much water is left in there. And that's it. I mean, that is it. And that's all possible because you made a channel. As the water went in, it caught into that channel and it came right out the other side. This is the exact same channel we just made on this young man's elbow. This was made for an actual cast, and this is the most important part. This is the part we're going to end the video on. I almost end the video on. I want to show you exactly what this patient did to this cast on the outside. I want to show you what this patient was able to do. Walking around in a pool, a concrete pool without a shoe, in a tub, on the poolside concrete, this patient destroyed the fiberglass. They destroyed the fiberglass, but look at the interior. It looks like it was just made yesterday. I mean, obviously, other than the edges, where you can see the discoloration from the chlorine, but other than that, if you look at the interior, it looks like it was just made yesterday. Again, this was a requested video on some tricks of the trade as far as little odds and end things you can do with Gore-Tex, with the waterproof padding. Anything else comes up, please leave it in the comments. Request it in a private message. I'll be more than happy to accommodate. Again, I hope this helps, and I hope this answers some of the requests that were put in. Have a good day, and we will see you at the next video. Thank you very much.